Welcome to this Oncology Data Advisor interview, which today we're holding in honor of World Brain Tumor Day on June 8th. And today's guests are from OurBrainBank, which is a registered nonprofit designed to move glioblastoma from terminal to treatable. I'm joined by David Robles, who is a Research and Outreach Program Manager, and Jacob Ellen, who is a medical student at Harvard Medical School and board member at OurBrainBank. David and Jacob, excited to have both of you on today.
Thank you for having us. Appreciate it.
Start off, would you like to each introduce yourselves and share what you do? We can maybe start with David.
Sure, yeah. My name is David, and yeah, I have been with our brain bank for over a year now. It's going on my second year, and what brings me to our brain bank? I lost my mother-in-law after an 8-month battle with glioblastoma, and after that experience, I firsthand saw like the disparities that exist, and I wanted to do something about it. And it's really been a privilege to be a part of this organization and try and have like an impact on people who are going through this the same terrible experience. And yeah, a little bit about what I do. So I've been leading some of their like research initiatives. We wrapped up a survey where we're trying to identify disparities across the nation that exist in glioblastoma care. And then now, working on some additional projects we are going to go into more detail today. So yeah, I'm just excited to be here.
Awesome. And I'm Jacob. I'm a third-year medical student. I've worked with our brain bank actually since 2018 with the original founder, Jessica Morris, who had glioblastoma. I've been involved with and sort of guided a lot of the research projects we've done and advocacy work we've done. I'm very excited to be involved going forward. I think most of our research centers on quality of life in glioblastoma for both patients and caregivers, and kind of exploring how we can better support them going forward. I sort of came to this organization because of my own brain tumor diagnosis actually during high school. So that's how I originally got connected and became passionate about this work.
Thank you for sharing. Excited to talk with both of you today. So when we last spoke about a year ago, David and Kelly and I met at ONS last year. You shared the survey that our brain bank was currently leading to identify disparities in care for patients with GBM and their caregivers. And now the results of the survey have been accepted as an abstract at the upcoming ASCO annual meeting. So first of all, congratulations on the abstract. Would you like to tell us what was the basis for the survey and why it was conducted, and then what were you aiming to investigate in it?
Yeah, definitely. First of all, thank you. And I think the project and the survey really started with a growing recognition upon talking with both patients and providers that access to high quality glioblastoma care doesn't seem to be very consistent across the US. So we know that glioblastoma is a super aggressive cancer that requires a lot of resources and multidisciplinary treatment. And we felt that the journey was likely to look very different depending on your own personal circumstances. So I think we had a pretty good sense of what glioblastoma care can look like at sort of large urban academic institutions. But what does it look like across the entire country for everyone? What do these differences look like? It seems like the data on this was lacking a little bit, and we could add some value by like going directly to patients and learning more about the patient experience from a variety of perspectives, I would say. So we want to understand like how factors like where someone lives, their educational attainment, insurance status, et cetera, might influence their ability to access treatments and might influence their care journey. So I think this goes hand in hand with our brain bank's glioblastoma Bill of Rights that was written a few years ago, that sort of asks and demands certain basic aspects of care, including kind of tumor testing for all patients and access to standard of care treatments.
Great, thanks for explaining such important questions to ask. So how many participants were involved in the survey, and what were some of the demographics?
Yeah, so I can take that one. So we ended up having 525 people participate, 23% of which were patients, 77% of which were caregivers. And the caregivers were either taking care of their loved one currently or their loved one has deceased within the past year. So we did want, a level of recency in that experience. The median age was 59 years old. About 58% were male, and 55% had a college degree or higher. And the majority at 88% were white, where 66% had private insurance, and um, about 86% were living in an urban residence. So that was defined as having like a population that was characterized by living in an area that was classified as like urban. And yeah, so those are a little bit about the demographics. So they were pretty similar to what the national averages or the national demographics of GBM patients, what they look like. So that was something that we were aiming to do. One of the things that stood out was that, our cohort was on the like the younger end of what the national average is for those who have GBM, and then also they were highly educated.
Great to know. So what were some of the key findings and disparities that the survey revealed?
Yeah, so I think we're still going through a lot of the data, but I do think one of the clearest findings we found is that lower educational attainment was pretty consistently associated with reduced access and information about key aspects of glioblastoma care. So participants without a college degree were significantly less likely to undergo tumor testing, looking at mutations, to be informed about tissue storage, offered clinical trials, discuss a second opinion with their provider, sort of across the board, and also reported generally lower satisfaction with their care overall. And this was even sort of adjusting for factors including financial difficulty, age, race, geographical location, insurance status. All of these associations remained, even adjusting for all of those things. We found that financial difficulty that someone's experienced in the last year was also linked to lower care satisfaction overall, although it didn't have the same strong associations with kind of access to testing and clinical trials as well. I think we found, like, kind of adjusting for those same variables, we looked at patients who had received care at like an NCI affiliated facility, and found that those kind of treated at those facilities were 3.5 times more likely to be offered a clinical trial than those not, in addition to some other findings. I think broadly, we found some kind of differences by geography, race, and age. I think rural patients, older patients, and non-white patients were less likely overall to be offered clinical trials. And we did find that sort of rural patients did have a longer time from their first symptoms to ultimately being diagnosed with glioblastoma, which we know is very important. So that was sort of a very large overview, and we're still kind of continuing to formalize a lot of the results, but I think those are some of our initial findings.
Great. Thanks for explaining. I'm sure a lot of those are very eye-opening conclusions.
Yeah.
So what are some of the implications for these results? How can they be used to better understand disparities and how to reduce them?
Yeah, I think the implications are pretty significant. I think they confirm sort of our suspicions going into this, and based on other studies, that disparities in glioblastoma care aren't just kind of theoretical. They're sort of actively shaping the way that people receive treatment and care of patients and caregivers right now. I think it's interesting that education appears to be a pretty key determinant of patients' kind of illness trajectory and the kind of care they receive. We don't have like a factual answer on this yet, and we may do kind of further going back to patients and see kind of firsthand accounts of what their illness experience was like. But I do think that potentially it has maybe rooted in like feeling empowered to access certain treatments and to ask about options like trial or second opinions, and to feel comfortable in that space. So maybe kind of by documenting some of these gaps, including that gap, we can educate for kind of better communication. We can work on having better patient navigation services for patients, especially those being treated at non-major academic centers. So I think we're hoping that this kind of data is sort of the start of more like policy level change and aimed at kind of standardizing care across the nation.
That's amazing. Well, thanks so much for telling us about this abstract, and looking forward to the presentation at ASCO as well.
Awesome.
Hey, you're also here today to tell us about one of your other ongoing projects, the DANO Project. Would you like to give us a little bit of information about this and what it's investigating?
Yeah, happy to say a little bit more about it. I think that so OurBrainBank had sort of started with a previous mobile symptom tracking app that was started in 2018 that we ultimately ran a study with for a few years. I think that what we found is that the app was very useful for some patients who liked being very involved in their care and kind of rating and tracking specific symptoms over time to keep track of their illness trajectory. I think it really did not work for other patients. I think some patients did not want kind of the burden of having to input their symptoms periodically, and didn't want to be reminded of their illness on a daily basis, which I think makes a lot of sense. So this is sort of would be a follow-up to that. So it's called the DANO Project. It's the Digital Assessment in Neuro-Oncology. It would hopefully be kind of a multi-institutional study that we're trying to conduct, looking at social isolation mostly and sort of social support in glioblastoma patients as well as their caregivers. And the way we would do this is to kind of use passively collected mobile phone data to monitor things like patients' movement patterns and activities, and not have to rely as much on sort of actively inputted symptoms, but still be able to get a good sense of how we can help patients going forward. I think this is particularly important because glioblastoma is not just sort of a medical condition. It can be incredibly socially isolating, especially as people's illness progresses. I think that both patients and caregivers, from what we found, can feel very cut off from their networks. So this would be one way of trying to sort of measure and quantify that in a way that's sort of less burdensome than and difficult for patients.
That's great. Yeah, it sounds like it really helps reduce that time burden while still capturing that data that can help to improve outcomes. So how do you plan to conduct this project and use its results to inform interventions for social support in glioblastoma?
Yeah, I think that we're sort of finalizing the study plan and working on implementing the project, but I think our plan would be to sort of enroll newly diagnosed patients as long with their caregivers so we can sort of track differences in quality of life and activity and things like that. We could look at metrics like time spent at home, distance traveled per day, along with sort of having periodic, less common surveys on patients' kind of loneliness and social support as their illness progresses. I think there's a number of things we'd be able to do with that, which may include sort of better characterizing how patient social isolation and loneliness changes throughout the illness journey, as well as maybe being able to kind of predict early signs of kind of disease progression as we see these metrics change over time. So there's a lot of kind of options, but I think our real focus is on quality of life. I think long term, our hope is that this could kind of help inform providers or nonprofits about sort of when and how to engage with patients that may be at risk of sort of falling through the cracks. Whether this could be used to shape interventions like peer support programs and groups, caregiver services, or kind of more telehealth-based social visits, I think would all be very interesting if we can sort of characterize those things better.
Definitely. That's amazing. And we'll definitely have you on again in the future as a study progresses to hear more about it.
Thank you.
Awesome. So last question today for both of you as we wrap up is, since June 8th is World Brain Tumor Day, what messages would you like to share with the audience regarding either of these projects or regarding glioblastoma and OurBrainBank's work?
I think the first thing is that I think for people who's received a glioblastoma diagnosis, it may be a rare disease, but it doesn't feel rare to them. It's very urgent and devastating. And we're sort of fighting for more attention and funding over time. I think that OurBrainBank is one of the only kind of patient-led organizations dedicated only to glioblastoma. So we're proud to be driving research kind of with patients, not just on behalf of them. I think is something that's become more and more important over time. This is really research that's directly informed by kind of on the ground surveys and information and talking to patients regularly. And then the last thing is that these like kind of disparities in care we're beginning to see and that we've uncovered a little bit more about are real, but are also very addressable. We hope that kind of this information is the first step in doing so. And then action can follow to make sure that kind of every patient, no matter their background, gets access to a basic and sort of standardized level of care.
Yeah, and I would also like to urge people to, join us in our efforts. I could share our general email address, and then we also have a way to sign up for our volunteer list or our newsletter. So I'll share those links. And then, lastly, we are always looking for support in funding this research, especially our latest DANO project. So, if there's anyone that would like to help, either through donations or if someone knows people who, would be interested in funding this type of research, please reach out to me, reach out to us. Yeah.
No, that sounds great. And we'll include those links in the article, and I encourage everybody to check them out and get involved. Great. Thank you so much, David and Jacob, for coming on today to share this work with us. It's always great to have you on and hear about the work that OurBrainBank is doing. So thanks again for your time today.
Thank you for having us.
Yeah, thank you.